Good morning. My name is Lamar Pritchard, Dean of the University of Houston College of Pharmacy. It is my distinct honor and privilege to serve as co-host with Provost Short and Interim Vice President of Research and Technology Transfer, Ramanan Krishnamoorti, for this momentous groundbreaking. I will be acting as Master of Ceremonies for today's program. Before we begin, I would like to acknowledge some of those in the audience today. Members of the Texas Legislature, Representative Alma Allen, Senator Paul Bettencourt, Senator Sylvia Garcia, Representative Rick Miller, Linda Swan Adkins from the office of John Zerwas, and Representative Armando Wally. We also welcome UH System Regents Durga Agarwal and Paula Mendoza, as well as former Regents Bo Smith and my good friend Welcome Wilson Sr. We'd also like to welcome other members of the UH administration, friends and donors of UH, and our College of Pharmacy, members of the UH Facilities Planning and Constructions Department, our architectural, engineering, and construction contractors. At this time, it gives me great pleasure to invite Provost Paula Myrick Short to the microphone for a greeting.
Thank you so much, Dean Pritchard. It's an honor to be standing here this morning and seeing a dream come true. We're so excited about this, and thanks all of you for being here this morning and sharing in this excitement with us. President Renu Couture sends her regrets. She wanted so much to be here today and is unable to, but we know she's here in spirit and energy and vision, and we're excited to be able to move her ideas forward with this wonderful building. I can assure you of her commitment to the new Health and Biomedical Sciences building and her efforts that she's put forward all along to bring this to fruition. As all of you know, it will be the home of the new home for the UH College of Pharmacy, and it will help us to consolidate our pharmacy faculty and students who currently are housed in the Texas Medical Center and across campus to better integrate and strengthen our teaching, research, and service in our world-class College of Pharmacy. This facility that you see under construction behind me will provide a state-of-the-art infrastructure, something we've needed for quite a long time here. This is needed to increase our faculty and our student enrollment, our faculty hiring, and our research funding. So we're going to see enormous results from the construction and the opening of this new facility. This building is also exciting in that it will house the UH Integrated Clinical Care Center, offering primary medical and behavioral health care services. The university will partner with a federally qualified healthcare center and a behavioral healthcare provider to deliver services. The Integrated Healthcare Center will be positioned to support surrounding communities, aiding in the elimination of regional health disparities. So as you can see, this is exciting for the University of Houston, it's exciting for our campus, and it supports President Couture's Tier 1 vision and the university's efforts at being relevant to our community and regionally and nationally competitive. Thank you so much for being here today.
Thank you, Provost Short, for your words. I want to thank you for your commitment to the academic excellence, shared governance, student success, and the collegial environment in which all of us are working as a team to move the University of Houston toward greater accomplishments. This new Health and Biomedical Sciences building would not be possible if it wasn't for the support from our partners in Austin. I would like to invite Senator Paul Bettencourt to come forward and say a few words.
Thank you, Dean and Provost. It's a great day to see a Tier 1 vision in reality come out of the ground. There's no debate at this point in time that we're not in a Tier 1 university with a Tier 1 vision. And one of the coolest part of the job that I have, and I also see Representative Rick Miller, is that you get to vote for things and then they show up, okay? Now, Welcome knows that in this type of job, what's the coolest part of it is when you get to vote for things that save people's lives. That's the best. And you're looking at a health and biomedical science center. It's $145 million. But what we don't know is how many lives it's going to save, what cures or for disease that comes out of it, what practical medical applications come out of this type of cooperative building, especially when you get all the disciplines together in one place and they start working. And I know that's what the regents support because they see this vision as well. So the chancellor's vision, the regent's vision, your vision is right here coming up out of the ground. And with that, I can only say that I welcome the opportunity to come back and see a lot more people in white coats standing around doing their job in the building. And oh, by the way, I see my county tax assessor, Mike Sullivan, who is not coming to the tent. But we're all here. Yeah, that's right. Well, you have to out them. We're all here. And if Senator Garcia was here, she would be saying the same thing. We spend a lot of time at PBS Red, White, and Blue debating the politics of the day, but we're absolutely both committed to being here for the university because what U of H does today is really the cures for the healthcare issues of tomorrow. And I'm really proud to have been signed up on the shift. And again, I just wonder at the medical health of our national treasure, which is Welcome Wilson, okay, who started originally his government service in the Eisenhower administration. So we should give him a hand. And I think they need to do a genome type on you, Welcome, so we know exactly what we're doing here in this building. But again, thank you to the chancellor, the provost, the dean, all the teachers and the students that will use the building. I look forward to seeing what your great successes will be out of the Health and Biomedical Science Center here at University of Houston in the future. Thank you so much.
Senator, that's a great idea, to have Regent Wilson donate his body to science. I bet we would be surprised what we found out, that mankind has come a lot further than we thought, isn't it? Wow, that's a great idea. Thank you, Senator Bettencourt. We thank you and your colleagues for your dedication to academic excellence and student success and your commitment, which all of us are working as a team to move the University of Houston to greater accomplishments. Paula, are you speaking next, or is it Ramanan? Okay. I would like to ask Provost Paula Myrick Short, the Senior Vice President for Academic Affairs and Provost, to return to the stage for some very special people. Paula?
Getting a little windy up here, so if you see our notes flying everywhere, just grab them and bring them back to us. So, I will say, as far as what I've learned about Welcome Wilson Sr. is that I've never known anybody that can be kicked off a horse and get right up and get right back on it and keep riding, even with a broken shoulder. It's just amazing. I have quite an honor to be able to thank those that have invested in our efforts here at the University of Houston to build this wonderful building and enhance our healthcare goal and vision for the university. There are many people that have already made an investment to ensure that this facility does save lives, as we've said earlier, that we can bring the best healthcare to our citizens, and that we can prepare the best health providers and educators and researchers to serve our students in our community of Houston. And today I have the task of acknowledging just a few of those folks, but these are folks that have made very significant investments in our HBSB2 building through their philanthropy. They are the Cullen Foundation, Paul and Myrick Ikari, the UH Foundation, Professional Compounding Centers of America, known as PCCA, and later in our program, you will hear from Mr. Dave Sparks, who is CEO of PCCA, and Celso Quara Jr., who has also made significant contributions to ensuring that this building is state-of-the-art and the best that it can be. Each of these individuals and these foundations, organizations, have made significant contributions. They are significant partners and supporters with the University of Houston, investing not just in this building, but also across our campus. So thank you to those that I named, because your long-term help to the University of Houston is recognized all across this great university's campus. You really are helping us come together and build the University of Houston of tomorrow, and we are indebted to you for your philanthropy. So thank you to all of you, those in attendance today, who've given support to this wonderful new building and the University of Houston. And I can tell you as Provost, and I know I speak for our extraordinary President, Renu Couture, that without you, nothing would be possible here. Thank you.
So welcome to all of you. I'm Ramanan Krishnamoorti. I'm the Interim VP for Research and Technology Transfer. It's a real pleasure to have all of you here, and thank you, Dr. Short, for getting us kicked off with this. Research and its impact on translation, especially in practice as well as in the clinic, is really something that the university does with great pride and joy. And it's really that translation of taking fundamentals in the area of pharmaceuticals, in the area of medical sciences, and building it out into real-world applications where we can impact the world is what will happen in this building that's going to be coming up here. UH, as you all know, not only leads in fundamental sciences and engineering, but is also a leading practitioner in the area of intellectual property. UH is the first amongst all public universities without a medical school in intellectual property revenues, and that largely comes out of two blockbuster drugs that have come out as a part of the University of Houston's intellectual property portfolio. One is Vimpat. This is an anti-epileptic drug, and busulfan is another drug that has also really brought in significant glory to the university in how we have transformed not just doing the science, but actually bringing it to the clinic and impacting people. I want to acknowledge our faculty who've done a lot of this great work. One such exemplar is Diana Chow, standing in the background there. Diana is the latest inductee in the National Academy of Inventors, a real sort of a who's who in the place where people look at how technology transfer happens. I want to acknowledge two other people who have really made this building happen. One is Dr. Earl Smith, Dean of Optometry, and also the former lead of the health initiative here, and now Dr. Steve Spann, who's the planning dean for the medical school here. So thank you both. I really appreciate everything that you've done. So Dr. Short warned me before, whenever we do a groundbreaking, the rains always come, so that I can feel the wind blowing, so I start getting move on the program here. So I'd like to reiterate our gratitude to our generous supporters here today who made this building happen. Philanthropy is a crucial component for the university to realize not only President Couture's bold vision, but our bold vision that is collectively being developed by the faculty, administrators, and the Board of Regents here, along with our visionary chancellor. Philanthropy ensures the university will be at the forefront of cutting-edge research and education, and that can create state-of-the-art facilities like HBSB2. Now, it is my honor to introduce one of the many individuals who's made this new chapter in the history of the university possible, Mr. Dave Sparks. I'll give you a brief background on him so that you know who he is and what he's done. He's really a tremendous person that we should all know more about. So, after moving to Texas from Oklahoma in 1988, Dave quickly rose to become the CEO of a young business enterprise called Professional Compounding Centers of America, now known the world over as PCCA. Over the past 3 decades, he's grown PCCA into an internationally renowned leader in the field of compounding, serving more than 3,500 independent pharmacist members located throughout the US, Canada, and Australia. Dave, along with his late wife, Kay, a skilled pharmacist and educator in her own right, has been a dedicated supporter of the university for decades. A generous gift from PCCA will name the Compounding and Sterile Products Laboratory in HBSB2, where students will learn the art and science of preparing safe, effective compounded medications and sterile products. Ladies and gentlemen, please join me in welcoming Dave Sparks, CEO of PCCA.
Thank you very much. It is with great pride that PCCA is able to establish a state-of-the-art compounding and sterile products laboratory at the University of Houston College of Pharmacy, which we believe will contribute to the advancement of this incredible institution. PCCA's gift is a testament and our commitment to the highly productive partnership with U of H and the college that has been both mutually beneficial and mutually supportive over roughly 20 years of our organization's 35-year history. Our unique partnership has provided hundreds of U of H pharmacy students with the opportunity to learn the most advanced techniques in preparing safe, effective compounded medications and sterile products. This partnership also has exposed many students to the vast career opportunities available in the thriving fields of independent pharmacy, veterinary pharmacy, consulting pharmacy, and drug information services. In these settings, patients and prescribers both benefit from therapeutic solutions tailored to the patient's specific needs, which truly is the future of healthcare. PCCA is privileged to serve as a trusted source for not only compounded and sterile products, as well as pharmaceutical ingredients, but also as a trusted source for the information and training to our more than 4,000 clients. What is also inspiring about our partnership is the high caliber of skilled and innovative U of H students who have and will continue to complete advanced practice experiences at our Southwest Houston facility. As one quick example, a few years ago, we had a client who was having difficulty applying a medication into the inner ear of his canine patients. As a special project, a U of H College of Pharmacy student who was on a rotation at PCCA used her artistic talents to make a sculpture of a dog's ear canal. Having a physical model to work with allowed PCCA staff to better understand the anatomical challenges and develop a solution for our client and his patient. I'm also proud to say that many outstanding current and former employees who have contributed and continue to contribute to PCCA's success are U of H College of Pharmacy graduates. Whereas some might see competition, we're proud of our former employees who have followed their dreams of starting their own businesses while still turning to us for consultations, materials, and education as we all strive to provide the best service and products for our clients' patients. Thank you for inviting me to this ceremony, and thank you to all of those who have joined PCCA in supporting the vision of Dean Pritchard and Chancellor Couture. Thank you.
Thank you, Dave, for your leadership in pharmacy, especially in advancing the practice of compounding, and for PCCA's generous support for our college and the future of pharmacy education and research. Once again, on behalf of the alumni, the students, the faculty, the staff of the College of Pharmacy, I extend our deepest gratitude for the vision, leadership, and support of University of Houston President and Chancellor, Dr. Renu Couture, our Provost and Vice Chancellor, Vice President, Dr. Paula Short, the University of Houston System Board of Regents, Senator Bettencourt, and all of his fellow members of the Texas Legislature, and our many alumni and donors. The College of Pharmacy's new home in Health and Biomedical 2 will ensure continuation of the transformative process of moving our college into the nation's top echelon of pharmacy programs. This transformation was started in 1946 through 1950, when our College of Pharmacy became the first professional program at UH to receive national accreditation, just days before the first graduating class took their board exams. This transformation has been proudly cultivated over the next 66 years as our college has maintained uninterrupted national accreditation. And this new facility could not have come at a better time, as our college will be only the fourth program in the nation to undergo review next spring under the very latest, most stringent standards of ACPE, our national accrediting body. From the classrooms and patient care suites to the compounding and sterile products laboratory and the simulation center, this new home for our College of Pharmacy will allow our faculty and staff to educate and train the next generation of patient care providers using the latest pedagogical methods. In turn, these cutting-edge facilities will ensure our college maintains its legacy of excellence by continuing to lead the state and nation on the National Professional Licensure exams. Our students, faculty, staff, researchers also will continue to build upon our recent record-setting year of $7.6 million in research funding in 2015. This milestone places us in the top 25 pharmacy colleges nationally and ahead of our peer colleges at my alma mater, the University of Georgia, Chancellor Couture's alma mater, Purdue University, as well as The Ohio State University. Through our proposed UH Center for Drug Discovery and Development, we will enhance existing collaborations and cultivate exciting new partnerships with other researchers across UH and among our fellow Texas Medical Center institutions to bring new therapeutic and diagnostic discoveries to the marketplace and to our patients' bedside. My words cannot express the excitement among our alumni, students, faculty, and staff of not only seeing this building rising from the earth, but all the great strides that have been made by the university over the past few years alone under President Couture's leadership. Again, I would like to thank President Couture, Provost Short, Dr. Krishnamoorti, Senator Bettencourt, and our fellow members of the Texas Legislature, current and past regents, our donors and friends, and members of the UH College of Pharmacy Dean's Advisory Council for their relentless efforts to make this day possible. Now, let's turn some dirt as we also begin the important process of preparing for our move in 2017. Would our legislators, regents, donors, and contractors please join us for the traditional photos? We invite everyone else to please enjoy some refreshments. Thank you all for coming and being part of this defining moment in the history of the University of Houston and the University of Houston College of Pharmacy, as well as the future of patient care in our great state. Thank you.